Hello, good morning. So, we're trying to answer the question of whether and how multimedia can help to improve and innovate health services and systems. And I'll be looking at the issue of photography as a research tool. And I'm here today to talk about a digital photo essay, how we can get life-saving interventions to women and babies. So what is a photo essay? A photo essay is a series of photographs that are made to tell the story of events or create a series of emotions in the viewer. Photo essays can often demonstrate behaviours or show deep emotional stages. The images that make up this photo essay relate to maternal and newborn health and traces the story of women in Ethiopia as they go into labour and the care that is received in the first hours and days of a newborn's life. We put them together using the shorthand social platform, which allows you to create visually engaging storytelling microsites for free. For the next few minutes, though, I will let the photographs from this photo essay do the talking. So now that we have followed these mothers and newborns on their journey, I will explain how this research came about, and I will cover the following topics. What is ideas? Charting progress of maternal and newborn health in Ethiopia. How photography can help improve and innovate health systems and services by enhancing research. And I'll touch also upon some wider debates and look to the future and what's next. So I am the Communications Officer at Ideas. Ideas is a project that aims to improve the health and survival of mothers and newborns by generating evidence to inform policy and practice. Ideas works in Ethiopia, northeastern Nigeria and India. And Ideas uses measurement, learning and evaluation to find out what works, why and how in maternal and newborn health programs. It is funded by the Bill and Melinda Gates Foundation and is based at the London School of Hygiene and Tropical Medicine. So how did Ideas come to use photography in its work? Let us look to the context in which this photo essay takes place and the progress being made in maternal and newborn health in Ethiopia. Ideas surveys in selected areas across Ethiopia, and I stress this data is not nationally representative, but it showed us that between 2012 and 2015, births at health centres increased from 14% to 43%. More women had the recommended 4 or more antenatal care visits. Births attended by skilled attendants like doctors, nurses or midwives increased from 15% to 46%. But not all health workers and families adopt the behaviours that could be the most effective in saving lives. In phase 1 of Ideas, which has just been completed, and we look forward to phase 2 now to 2020, the project work was focused through 4 learning questions. The second of these could be sort of summed up as focusing on the mechanisms of change. And a part of this work was looking at why health innovations have or have not been successful in enhancing interactions between families and frontline health workers. Ideas and its partners were conducting field research in Ethiopia, and the team aimed to explore the barriers and enablers for the adoption of certain health-improving behaviours during pregnancy and the first hours and days of a newborn's life. They were particularly interested in the role that community health workers could play, and ultimately they wanted to know why change happens. Were these community health workers able to promote healthy behaviours, such as the active management of the third stage of labour, thermal care, clean cord care, weighing the newborn, or immediate breastfeeding. The qualitative methods deployability included background work, in which community health workers were trained to make early postnatal care visits, and community health workers helped identify deliveries. 2 typical gabeles, that is, the smallest administrative units of Ethiopia, similar to wards, with reasonably functioning community health workers, were used as study sites. Respondents to studies included recent mothers, grandmothers, fathers, community health workers, and volunteers. Data collection methods included narratives, in-depth interviews, friendship pair interviews, and focus group discussions. Perceptions and experiences with postnatal care visits were monitored, and analysis was undertaken with deductive and inductive coding and interpretation through en vivo. The team made use of several alternative and creative methods that were aimed to try and get the participants to talk openly and honestly about their experiences. The team deployed the picture round as one of its tools, and in this, participants were shown pictures of the correct and/or incorrect execution of various life-saving behaviours. At the beginning of the research, the team used more generic pictures of health workers, mothers, and babies. But the team encountered some problems using this approach. And this quote from a member of the IDEAS team at the time, Dr. Pauline Stierbeck, illustrates this. We had to try out some of the picture rounds with pictures from several big multilateral organizations, and most of the comments we received from the participants were, "This baby is not from here, this mother has a strange necklace," etc., which was not very helpful for our research. So we had a problem. At the very same time, though, IDEAS had been in contact with Paolo Petruno, an award-winning social documentary photographer and videomaker who'd been based in various African countries over many years. Paolo was asked to provide materials for IDEAS publicity needs, like images for its websites, publications, presentations, flyers, and so on. However, it became quickly apparent that Paolo's work could become a core research component in documenting specific behaviours that the IDEAS team wanted to discuss with the local population in its research and record in its research. So we brought Paolo on board for this project to document behaviours at birth in Ethiopia. How did this help our research? So with Paolo's new local photographs, the discussions with the respondents became, in most of the cases, much more focused on the behaviour itself, and proved a major help in understanding the drivers of local maternal and newborn behaviours. This in turn generated locally relevant evidence that directly informed health programming, which in turn altered the delivery of health care and in turn the health behaviours. This evidence was shared with the government and implemented for course correction through a series of academic papers, reports, presentations, and one-to-one meetings. So what were the lessons learned in using this approach to research? Following Paolo's work, colleagues from the IDEAS team got together and to evaluate what had worked well, what had not worked not so well, and what should be considered for the future. Well, the first lesson was that this photography can be a powerful research tool. Secondly, it was essential to seek appropriate permissions. Such multimedia approaches are potentially slightly different from traditional or standard research methodologies, so getting permission was key. Strong partnerships are needed for effective cooperation, for effective coordination and access, and IDEAS had a strong relationship with its partners in Ethiopia. The logistics required detailed planning, and in this case nearly 5 months, and challenges were faced inadequately drafting contracts, agreeing or appreciating how time could be most effectively used, and establishing a support network for the photographer. When using a non-national photographer, it can become very expensive when you factor in costs such as flights and visas, etc. So taking into account all of the points above, there is a strong case for using a local photographer in such research work. So how can multimedia, like photography, help improve and innovate health services and systems? Well, photography can begin a conversation about topics such as maternal and newborn health. Powerful images may prompt or catalyze action, getting emotional buy-in from key decision makers. Photography is a different way of presenting or articulating data and context in research. Photography can build on and complement an evidence base, and thus it can be a powerful tool for advocacy as well as research. Despite this, there are some concerns in such an approach. For example, is photography really a reliable tool? Is it unbiased? There's factors such as social desirability bias, i.e. when subjects give the answer that they think is right. This is a reason often why photography is used in such context, but is susceptible to such bias itself. Do people's behaviour change in front of cameras? In our example, this could be applied to all of the participants, but especially the health extension workers who might feel pressure to change the way that they behave in delivering care. There's also the ever-present issue of ethics. Do the subjects in the photographs truly understand what is happening when they have their photograph taken? And even when they give their consent, do they know in what way and for what purpose will the images be used in the end? Photographs only capture a moment. Is then the selection of images biased? So this point is highlighted by this amusing post by Board Panda, which shows famous tourist landmarks at different times and contexts. They're all the same location, but at different times, and this demonstrates how both images of the same place can both be truthful, yet both convey very different experiences. Before I end, I would like to open up this topic for some wider issues of debate. It is widely recognized that there's still a global imbalance in the production and utilization of knowledge and development. It is the same with the commissioning, production and use of multimedia content for social and economic change in low-middle income contexts. In the era of the Sustainable Development Goals, there is an explicit focus now on the production and use of local knowledge and evidence for sustainable change. We should take this approach just as seriously in the multimedia tools that we produce for research and advocacy. I also wonder if we're a bit behind the curve in the world of rapidly changing technology. New, diffuse and connected networks have dramatically changed the way that photographs are captured, shared, used and engaged with. So as it transpires, as part of the London School of Hygiene and Tropical Medicine's public engagement initiatives, in 2017, IDEAS will be working with its partners in Gombe State, Nigeria, on the project The Gombe Girls for Maternal and Newborn Health. This new project adopts some of the principles, such as photo voice, and puts the young women directly in charge of capturing, interpreting, and sharing the evidence they find about the quality of maternal and newborn care in their community through multimedia. So to summarize, photography can be a good tool to generate locally relevant evidence. This evidence, complemented with the images, can also be a powerful tool for advocacy. However, photography and other multimedia approaches do have shortcomings, and most notably the susceptibility to bias. And I would argue that emerging technologies and approaches need to be further harnessed to increase impact. Finally, multimedia alone is not enough for change. You do need evidence, you need data, and you need an alignment of social and political factors and actors to see sustainable change at scale. Thank you.